Good evening and welcome. As the numbers of Omicron cases rage across our country, there are serious questions being asked about whether it was necessary or why it was necessary for India to change its testing guidelines as far as COVID cases are concerned. Some of the changes actually pertain to those who could be caregivers of those who are COVID positive, but in case these caregivers are healthy themselves, then they don't necessarily need to be tested for COVID. And that's a matter of concern, because even if a person is in close proximity to somebody who is COVID positive, the new guidelines seem to suggest that they don't need to test. So in the past, when we've spoken about COVID, it has always been testing, but that appears to change now, perhaps reflecting the changed reality of Omicron. Joining us now, a very special guest, Dr Jayaprakash Muliyil, epidemiologist and chairperson of the Scientific Advisory Committee of the National Institute of Epidemiology at the Indian Council of Medical Research. Sir, first question, because a lot of people are asking about this: why should healthy contacts of COVID patients not test for COVID themselves?
I think we have a frame of mind set in the early days of COVID entering India. At that time, the whole focus was on elimination. So find the case, isolate. That was a rule those days. That evolved along quite unnecessarily. But if you remember, ICMR had much earlier came out with the directive saying you only test those who are affected, symptomatic.
Right.
However, most state governments went on to check contacts and so on and so forth. Didn't make any difference, finally, the evolution of the disease. Now, the focus need to change dramatically, because we are dealing with quite a different virus. It's much milder than Delta, as you all know. Not only that, it is practically unstoppable, and it spreads very fast. But that is not the main issue. The issue is that the consequence of a viral infection is just like that of a cold. So given that background, I think we have to recognize that we have been chasing a particular kind of objective so far. Now, the objective of elimination...
I'm sorry, Dr. Muliyil, did you just say that this is a disease which, Omicron, which presents itself just like the cold?
Absolutely.
Sir,
that is exactly
there are hundreds, there are thousands of patients with Omicron who would suggest that the symptoms that they face are far more severe than just a common cold. Even in this particular case, O2 saturation does dip, perhaps not catastrophically. There is a jump in oxygen beds in hospitals. There is a jump even in oxygen in ventilator beds in ICUs and hospitals. It may not be as severe as Delta, but it's not a common cold, sir. That's not what people who have gotten this say at all, because many have recovered.
Very good. That is exactly what it is. Maybe when I'm trying to get to you the important point which made the change in the decision, you should remember, first of all, I said it's almost unstoppable.
Right.
Because it's highly infectious.
Right.
If it comes in, majority of us will not know we have been infected. Probably more than 80% will not even know we are
Dr.
infected.
Muliyil, have we given up on our COVID policy? That is it now inevitable that we'll all get it? Is that what you're saying?
That is correct. It's so infectious, much more infectious than Delta. But the consequences are quite different. A few will get hospitalization,
right,
compared to Delta. We have to have a frame of mind that we accept that it is not a frightening disease anymore. Omicron is a disease we can deal with.
So we are all going to get Omicron. You're saying this, that not all, exactly. But the chances are that all of us will end up getting it in a finite period of time.
That's correct.
So one question therefore, and because this does open a can of worms, can't direct contacts of COVID patients infect others if they don't test themselves. For example, if there's a healthy person, a caregiver of say their parents, right, Omicron is so transmissible, that individual picks it up, the young person who's healthy, maybe asymptomatic, maybe mildly symptomatic, they go out into society and they end up infecting possibly senior citizens or those with comorbidities. We have a burden of comorbidities in India, sir, for all sorts of reasons. Are we therefore not letting our guard down?
Yes, that is a expected question from everybody. The point is that there is a way we can block certain infection, and this particular respiratory infection, the rate of infection is so high and so rapid. You know, the doubling time for this virus is 2 days. So we are talking about extremely infectiousness, and by the time you pick up a person who has got a disease, he is already infected a large number. So even when you test, you're far behind. It is not something that will make any difference in the evolution of the epidemic. Everywhere the story is same,
right?
Rapid climb. So given that,
yes,
the only thing is we could go for very hard measures and just lock down the whole thing and sit inside the house. How long? And also, even that won't make a difference.
Right.
But the point we have to remember, when you compare Delta and Omicron, it's such a milder disease.
Right.
You have to emphasize again and again,
right,
just to change the mindset of the people, because we are still...
So it's not milder for those with comorbidities. It's not milder for those with kidney disease, with heart disease, with diabetes, and a plethora of comorbidities. The numbers in our country, sir, respectfully, with these cases, and it's not limited only to those who are 60 plus, right? We are not a very healthy people. No, let's face it.
I'll try to explain it. You know, remember the graphs we used to see in the beginning with the age-specific curve. Yes. It goes exponentially up. Yes. Very old age, you have high mortality. Now, the interesting thing about Omicron is that curve has come down in all age groups.
Right.
The young and mild, there was very few in hospitalization.
Right.
Even less than that. Even in the older age group, it has come down. Uncontrolled diabetes and things like that are still a problem. And in fact, the precaution they have to take continues in terms of personal protection. But it is a huge shift in the mortality pattern.
Okay.
And that has to be explained to people, because how long do we have this fear looming over us?
So, Dr. Muliyil, my next question, without more tests or ramping up tests, because tests as a percentage of the rise in cases is just a fraction. The tests are not nowhere in the ballpark of keeping up with the jump in cases. Now, without more tests, how will India gauge the true spread of Omicron? How will epidemiologists like you do your jobs as epidemiologists if you don't have the most basic data of all? How many?
We have learned to live with it, because even when Delta was around, we always multiplied the number of cases picked up by about 30 to get the real number. This particular one, we just had to increase the 30 to probably 60. That is the difference, because such a large number is subclinical, will never come to anybody's notice. Even the person will not know. So that is a reality. So we have to stop counting the virus. In medicine, viral infection, in fact, isolation of virus from a person is not equal to disease. Disease is something and infection is different. In the case of HIV, we used to equate it, because invariably in HIV, they used to fall ill subsequently. But in all other viral infection, majority of people would get subclinical infection,
right,
and that doesn't pose a public health hazard.
So, Dr. Muliyil, the numbers we come out with daily, X number of Omicron cases, and that number is never right because it takes days for the sequencing number, so it's always inaccurate if it's reported on a daily basis. or X number of COVID cases, shall we just forget all of these numbers right now because the numbers are so large that the real numbers are not being reflected?
I think the problem with this, most people look at this graph and the eyes shine when you see it going up or down. Now, these are just some sort of a data we have been gathering, and we always knew it. We got stuck with from the beginning. We are still looking at those numbers. Now, one thing I'll tell you, for ordinary people, it's very easy to look at the number of RT-PCR positive. Okay?
Yes.
And those numbers, if you look at it itself, you'll know, after the delta reduction, whatever rise that occurred is all due to Omicron. Whether you do the testing or, confirm it. There's no need to confirmation. It is Omicron all the way.
Right.
And so that itself will tell you, and the beauty is, with that crude line, when it starts falling, you know we are reaching the end point.
Right. So the numbers going up now in terms of the statistics, are you suggesting we ignore it?
No, I'm saying that it will be there because we are used to seeing it. It is nowhere near the truth, but the shape of the curve going up and coming down
is all that we need to worry about.
That's right.
Because it's nowhere near the truth. It's nowhere near the actual number.
No, nowhere near the number.
What percentage of the number do you believe is being shown right now?
See, earlier we used to calculated for the delta, that is, we see about 1 in 30. In Omicron, it must be somewhere between 1 in 60 and 1 in 90. This is guesswork because subclinical infections have gone up. Okay,
right.
that is the reason. But unless you start measuring this on everybody, like UK and Europe have schemes by which citizens are expected to test themselves and report. That kind of mechanism will give you the curves of which is truer.
Which wasn't being followed in the UK, and it's not being followed here in India with home test kits. Let's face it, sir. We will never know how many people with home test kits have actually tested positive because people are not downloading the app and they're not putting the data over there. They're not.
Absolutely.
No, I take that point. We aren't getting the actual data. Next question, sir. It's question number 5. Should boosters for all be a key part of fighting COVID? Why aren't we boosting, sir? No, I'm not talking about comorbidity cases. I'm saying boost everybody after 6 months of their second dose.
Well, there is a philosophy world over that natural infection doesn't impart any lasting immunity.
Right.
Now, that is a philosophy which I think is wrong. And many like me also there who fight saying that, no, this once infected, and I have said influenza, people don't know this. When you get a natural infection, you have lifelong immunity. Measles, when you get a natural infection, you get lifelong immunity.
But Dr. Muliyil, if you are to suggest that natural infections give us lifelong immunity, are you suggesting therefore that the vaccines don't have any role?
I did not say that.
Okay.
The vaccines work because the original virus is naturally immunogenic. And you take it from that. If that was not so, your vaccines also won't work that easily. Here every vaccine works brilliantly. Except in India, we got the vaccine after 85% of the population have already been infected. Correct? You know that.
Yes, absolutely. But are we now waiting for 100% of our population to be Omicron infected before we roll out the boosters?
We don't have any other option saying this, whether you give booster or not.
It makes no difference.
Infection will occur. It has occurred all over the world, regardless of this.
Then why is everybody else giving a booster, sir? Why has the United Kingdom gone crazy giving boosters to everybody they can? Why?
Yep. You're probably asking the wrong person, but I didn't order it.
Or other countries, virtually every other country in the world. Israel is on to their 4th booster or something like that.
Yeah. Obviously, the third booster didn't work. They are giving the fourth booster, right?
Right.
So I think it's an option, and the people who have had most of the immunity from vaccination are not doing as well as countries like India, which has done most of the immunity obtained from natural infection. Okay? Now, in the case of Omicron, it doesn't matter because it ignores the previously acquired immunity from the original virus.
Right.
It's a new breed completely.
Right.
So one more thing you have to know is, even if I said so, those people who have been either exposed to natural infection or the vaccine, their clinical outcomes are better. So let us think of a person, an elderly man, who has taken 2 doses. And it so happened he was on some drug, he was not well, he didn't have a take. So this precautionary dose, not a booster, precautionary dose may help in at least introducing the antigen so that his
But
body...
Dr. Muliyil, how have we assumed that only 60 plus individuals have comorbidities in this country? Why can't 40 plus individuals have comorbidities? We have so many heart patients in very young ages in this country. Why aren't they being given a precautionary dose either?
The thing is, precautionary dose is given for people with a high risk of immunological non-response. Just because you have a heart disease
or diabetes,
it doesn't usually mean immunologically incompetent. On the other hand, some other condition like, where there is, for example, people on renals waiting for renal transplant, there are quite a lot of immunological depression. So the point is that Omicron doesn't, it ignores your immunization and infect, but immunization reduces the risk of bad outcome. I said that much. Now we are asking, why don't you give every person that is available who is a risk factor? Now, they already received 2 doses.
Yes.
Now let us think of the 2 doses. First dose came for most people after they had been infected, because 85% were infected.
No, but
that
what about those who didn't, sir? I mean, I'm just one citizen in this country, but I had my second dose about 9 months back. On the very first day that I could, I got my first dose. On the very day I could, I got my second dose. It's been way more than 6 months and I can't get it. Is that fair? Is it fair to individuals who say that they will buy their vaccine just to protect themselves? Is it not their right to do so?
Well, there are 2 views that we have to look at. On one hand, there is restrictions on people attending exams, children going for exams saying that you should not attend the exam unless you are vaccinated. Okay? There's one end of the spectrum. The other end is people dying to get a vaccine, not getting it. I mean, of these 2 lot, we have imbalances in the country. I agree with you. But I am trying to explain the logic of our immunity and the role of booster doses. We have not suggested booster dose so far from any of the bodies of the government, okay, to my knowledge. Precautionary dose was suggested because there are reports that certain people, mostly in the age group above 60, did not respond to 2 doses.
Okay. I take that point. So, sir, I'm running short of time. I have 2 important questions to ask you. Firstly, is India's strategy based on achieving herd immunity without giving the large number of citizens a booster dose?
I didn't miss it, but are you asking?
I'll repeat my question. Is India's philosophy at this present stage based on everybody getting a herd immunity, and in doing so, it would be speeded up perhaps by not receiving a booster dose?
No. In India, I told you more than 85% got infected before the vaccine arrived on the scene. So the first dose of vaccine most people received, whether they knew they had infection or not, that was a booster dose. Primary exposure was to the virus.
Right.
That is the majority of Indians.
Right.
So in India, a booster dose was already delivered and the first dose of vaccine.
Okay, I take that point, and that really does summarize your argument. One final question. You've said this earlier. I want to hear it again, sir. You believe that almost all of us in this country at some stage, perhaps soon, will get Omicron.
I did say that because it's highly infectious and most of us will somehow get it because it is a virus that spreads so fast, incredibly fast. We have watched the Wuhan virus, we have watched the Delta virus. This is unbelievable at the rate at which it is spreading. So
right.
the thing is, that could frighten people so that the sentence should continue. But this virus is of not the same consequence of the Delta virus or other viruses.
Okay.
It's milder.
All
It's
right.
important to know that. If you will fall ill enough to be hospitalized, but there won't be a rush that face Delta. Not at all.
All right. All right, so you've been extremely articulate and direct with your answers, and I think there's a lot for us to think about what you have said. Let's just hope that that curve starts going down so that we know that this is beginning to end. Thank you so much, Dr. Muliyil, for spelling it all out for us. Thank you so much indeed.
You're most welcome.